Hi, my name is Shawn Marie Clark. I have epilepsy. I also have a vagus nerve stimulator, or VNS. What is epilepsy? Epilepsy is a neurological disorder that causes the brain to malfunction, sending uncontrolled discharges of electrical energy to the cells in the brain. This causes the body to have seizures. There are many different types of seizures. Many seizures affect all different parts of the body, but the main source of seizures themselves start in the brain. Where and what type of a seizure a person has depends on the electrical disturbances and where they occur. What is a vagus nerve stimulator? The vagus nerve stimulator is designed by Cybertronics. It's also endorsed by the Epilepsy Foundation. To know what a vagus nerve stimulator is, you have to know what the vagus nerve is. The vagus nerve is on both sides of your body. It starts from the medulla of the brain and runs down the neck, into the chest, and into the abdomen. The nerve conveys sensory information about the body's organs to the central nervous system. It interacts with the autonomic body processes like blood pressure and heart rate, and it affects your moods and seizures. No one knows why it affects either one of those. The vagus nerve stimulator itself is a device that sends electrical impulses to the brain. It basically is stimulating the brain by shocking it. This tries to keep the electrical pattern stable, and if it's not stable at that time, it will shock it back in on track. It's a non-drug treatment for a treatment-resistant depression and epilepsy. The stimulator itself is the size of a pocket watch, and it sends a electrical impulse up the vagus nerve, which then interacts with the brain itself. The implant is called Pulse, and it's very small, it's very tiny, and you need a neurosurgeon to implant it, either that or a vascular surgeon. I have one, and it was implanted by a pediatric neurosurgeon. That's how tiny they are. The only problem with them is after every 7 years you have to go get your batteries recharged. So they have to open you up and put in a new battery. What the Pulse does is it sends electrical waves to the brain. It also receives data so that your doctor can customize your treatment. It can tell you the frequency of your seizures, the type of seizures, how long between seizures you've had, the severity of them, and your doctor can recalibrate them between each visit and make sure that he has it either where it needs to be stronger or less impulses. The device runs on cycles. It runs anywhere from 7 to 30 seconds on and up to 5 minutes off, and then back on again for either 7 to 30 seconds. It also helps when you're having a seizure. Excuse me, my device just went off. Or it actually went on, I should say. This is one of the side effects. Your voice gets scratchy, you sound like Froggy from Little Rascals, or it gets itchy, or it tingles. It only lasts for the entire time that it's on, and then it goes back to normal. Any other side effect from that is very minimal. There's really no pain or any major side effect that comes with it. Excuse me. Sorry. Anyway, back to how I can stop seizures or lessen the severity of them. With every implant comes a magnet. This is my magnet. If I'm in the middle of a seizure or a patient's in the middle of a seizure, you would locate the device, which is usually going to be on the left side of the body, right around here. You take the magnet and you swipe it over the device. And what this will do is if the device is not on, if it's on that cycling off period, this will turn it on. It'll jump start it. And then that will cause the brain waves into the brain, shocking them and putting them on the right track, which will either stop
the seizure right then and there, or it'll lessen the severity of it. Are there any risks to this? Basically, the only risk that they've found is infection from the seizure, from the surgery itself. Other than that, there really are no other risks. Is everyone a candidate? No. You have to have a long history of failed attempts with pharmaceutical treatments. They put you through a long history research trying to find exactly which drugs did use, which drugs you didn't use, what did work, what did not work, before they even attempt to pick you as a candidate. Does it work? Yes. I was having a seizure every month. I'm now down to it maybe one every 4 months. So my life has changed quite a bit. I am a new mom. I have a wonderful family. I'm able to do things. Everything has just totally changed. I hope that this has informed you about the vagus nerve stimulator. I would like for everyone to go to the epilepsyfoundation.org and learn more about epilepsy. Also go to Cybertronics, us.cybertronics.com, and learn more about the VNS therapy. Hopefully all these links will be able to be seen and you'll be able to go and explore and learn more about it. Thank you very much for your time. Again, I hope it has been very informative for you.